If you've been diagnosed with Mast Cell Activation Syndrome, MCAS, you know the exhausting reality. Managing antihistamines, carrying epinephrine everywhere, avoiding endless triggers that seem to change without warning. You got flushing, hives, digestive chaos, heart racing, brain fog, all at once with no clear pattern. And here's what's even more frustrating. Your doctors tell you it's idiopathic, which is a medical term for we don't know why this is happening. They manage your symptoms, but no one asks the bigger question. Why did your mast cells become hypersensitive in the first place? And that's what we're talking about in this video. This video is for parents and individuals who are tired of living in constant fear of the next reaction. You're frustrated with medications that only manage the symptoms, and you're ready to understand the nervous system connection and root cause that's been overlooked. You're going to learn why MCAS is often a nervous system problem, not just an immune condition. And we're going to talk about the vagus nerve connection that both conventional and functional medicine often overlook. We're going to be talking about the perfect storm that so many of our kids and even ourselves go through that triggers mast cell chaos. And we're also going to talk about why MCAS, POTS, and Ehlers-Danlos syndrome appear together so often. And we're going to give you a drug-free action plan to address the foundational nervous system dysfunction head on and without more medications. There's a lot we're going to cover, but today we're going to get into it right now by talking about this pattern. We see this in our office where someone comes in with an MCAS diagnosis, a bag full of supplements and medications, and a list of triggers that keep growing. They've seen the allergist, they've seen the immunologist, the gastroenterologist, and functional medicine experts as well. And everyone agrees the mast cells are overactive, but no one can explain why. What conventional medicine misses is this: mast cell activation doesn't happen in isolation. Research shows that mast cells respond to signals from the autonomic nervous system. When that communication is dysregulated, stuck in chronic stress mode, mast cells become hypersensitive to normal stimuli that shouldn't trigger them. MCAS is a nervous system problem. So let's dig deeper. First, if you're wondering what mast cells are, they're your immune system's first responders. They're stationed throughout your body to release histamine when they detect real danger. In MCAS, the activation threshold is set lower. They react to things that shouldn't be threats. And medicine doesn't explain this. Like, the immune system is controlled by the autonomic nervous system, specifically the vagus nerve. You can think of your nervous system like a car. The sympathetic side is your gas pedal. The parasympathetic side, which contains the vagus nerve, is your brake pedal. And in MCAS, the gas pedal is stuck down and the brake pedal doesn't work. So your nervous system interprets normal things as threats. And so mast cells release histamine in response. This is called sympathetic dominance, and it creates the environment for mast cell chaos. So, how does this happen? MCAS doesn't appear out of nowhere. It's not random. It's not just bad luck. It develops after years, sometimes decades, of a constant onslaught of stressors overwhelming the nervous system and immune systems. Teen girls, young adult women, and moms are carrying an unprecedented load of stress in three major categories. The first is chemical stress. There's so much exposure to endocrine disruptors from plastics, from BPA, from heavy metals, mode exposures. There's so much that's happening, and these compounds don't just affect hormones. They affect the signaling and the mast cell behavior. And when mast cells are constantly exposed to chemical stress, they become hyperactive. Because on top of that, we have birth control, we have SSRIs, we have all the medications and the steroids and the other prescriptions. There's even more chemical stress. But chemical stress isn't the only thing that's stressing us out, because we have physical stress. There's physical stress, which consists of hormonal, structural, and physiological stress, where we have this cycle of puberty, where we have a monthly cycle, when we get pregnant, when our system goes through depletion in our hormonal state. There's a lot of change. There's a lot of change with the physiology. It's not static, it's cyclical, it's dynamic, it's continuing to change. And then we layer in the lifestyle stressors as well, from sports, from overtraining, from undereating, concussions, different things that is going to cause a neurological and immune stress event. And the body has to adapt to that. And so when we add in all of these things, the body never gets a reset. And so over time, the autonomic nervous system shifts towards survival mode, and mast cells respond accordingly. But that's only the first two stressors, the first two T's of stress. There's a third T. We talked about the chemical stress, the physical stress, but there's also the mental, emotional stress, thoughts, emotional stress. And this may be the most overlooked. Mental, emotional pressure. We have academic pressure. With social media, there's just so much more stress and comparison, body image stress. We get into relationships, they come and go. There's so much more, which then drives the nervous system to have elevated levels of cortisol. That is your stress chemical that increases inflammation, that increases your reactivity to different stressors because the system becomes sympathetic dominant. It gets to a place where it's spending more days in survival mode because that chronic emotional stress drives all of this. And the mast cells are directly wired to these stress hormones. The vagal tone suppression. So when your system spends too much time in a gas pedal state, the brake pedal isn't coming online and we're getting dysregulated in all the systems, including the immune system, which then influences how our system continues to show up. So when the brain lives in fight or flight all the time, the mast cells are going to follow. And we can summarize this. We can summarize this in a three-stage progression that leads to MCAS, where stage one is the accumulation of stress. We have years of chemical stress, hormonal, physical, and emotional stress. These all stack up. And then there's symptoms that we see with that. And they're subtle at first. It can look like PMS worsening. It can look like migraines, anxiety, bloating, histamine sensitivity, and fatigue. And here's the frustrating part. Labs often look normal. So then nothing is done about it. And if the nervous system starts to spend more days here because stress keeps piling up, it shifts into chronic sympathetic dominance. That's stage two. It's a constant fight or flight presentation. And the symptoms now we see are often tend towards hormonal chaos, menstrual cycle irregularities, autoimmune markers, POTS symptoms, food sensitivity. Some people get hives, flushing, itching, and brain fog. And at this point, the mast cells are primed. They become hyperreactive because they've essentially been trained to do that. And so the system loses discrimination. That's stage three, where MCAS emerges. The mast cells begin reacting to things like temperature changes, foods that were previously tolerated, different smells, everyday stress, hormone shifts, and sometimes even supplements. And so at this point, it looks like everything is a trigger. But at the root of it, it isn't random sensitivity. It's long-standing autonomic nervous system dysregulation under chronic three T's of stress. And here's why MCAS and um, often it clusters with POTS, with EDS, with fibromyalgia and dysautonomia, because these aren't isolated conditions. They share a similar thread, a common thread, and that thread is the chronic nervous system dysregulation, driving the immune response, driving how the system shows up on a day-to-day basis and causing it to constantly misfire. But with that, unfortunately, that's not like what's being addressed when it comes to helping people in this struggle. Medicine often treats the histamine, the hormone, the anxiety, or the inflammation, but misses the central command center, the autonomic nervous system. Until that piece is addressed, this storm keeps cycling. And that's why medications aren't enough, because you can take the antihistamines, you can take the mast cell stabilizers and the leukotriene inhibitors to help manage symptoms and keep you safe, but they don't address why your mast cells became hypersensitive in the first place. Take this as an analogy. For instance, if you have a car and your car's parking brake is stuck, pressing harder on the gas does help you move forward, but you're burning more fuel. You're wearing out your engine and you still haven't released the brake. That's what medication does for MCAS. It helps you function without fixing the stuck brake. And what's the brake pedal in this case? It's the vagus nerve. It's that brake pedal. It's the parasympathetic, calming side of the nervous system. And when that's not working, your body can't calm inflammatory responses. So conventional medicine sees the mast cell problem, but misses the nervous system dysfunction driving it. So if we know the problem is rooted in neurology, we need to have a neurological path forward. At our office, we use insight scans to measure nervous system function and reveal what's actually happening in the body. I want to show you what that might look like. What we typically see in MCAS is high sympathetic activity, where the nervous system is essentially having the gas pedal to the floor. Like we see on this HRV, seeing how the nervous system is spending more time in that sympathetic dominant state. But what's also present is low vagal tone, essentially a weaker brake pedal, a nervous system that lacks the ability to regulate. So the system is way out of balance. And so there's another way we can see this present. Usually we'll see neurological exhaustion and tension patterns on another scan that we use through the neuromuscular system, which drains the system. So we see the activity, think of it as the body's battery, our ability to show up in life, our ability to handle the stressors of life is less than because our system is being exhausted. And we can see it in this scan here, the neurothermal scan. This measures autonomic function with blood flow and with temperature. But even more imbalance, there's shows up when the nervous system stays in this dysautonomic state. The temperature system starts to go haywire. The system starts to perceive this on the inside, and a nervous system presenting in this way leads to poor adaptability in life. It leads to a reduced resilience down the road to outside stressors and triggers because, again, its capacity to handle stress is less than. So we can find out what's going on through these scans and one other that we didn't show, the EMG, and we can then work to fix the foundational issue, the nervous system issue that caused MCAS in the first place. That's what neurologically focused chiropractic care does. That's what we do. It addresses the dysfunction by removing the stuck tone, the tension, the stress, this what we call the subluxation, especially where the vagus nerve is vulnerable, especially where the system has those calming centers of neurology. And as neurological function is then restored, as the brain starts to perceive better input, the vagal tone starts to improve, the brake pedal starts working again, and the nervous system shifts out of a chronic threat mode. And here's what we tend to see clinically, that the scans that we just showed, they often improve before the symptoms do. People see nervous system regulation on scans weeks before they notice fewer reactions because this is healing from the inside out. It's addressing that foundational dysfunction first. If the autonomic nervous system is off track, that then leads to those symptoms, we have to get the autonomic nervous system back on track before we start seeing those symptoms clear up. So the other systems that are controlled by the nervous system can come back online over the course of care. And these scans can be life-changing, truly. And they only take like 15 to 30 minutes to complete, helping you to truly understand what's going on deep within your nervous system so that you can develop a more effective drug-free action plan from there. So if you struggle with mast cell activation and you want to dig deeper into the root cause, click the link in our bio or send us a DM to learn more about the role that sympathetic dominance, dysregulation, and dysautonomia may be playing. Or if you're just flat out ready for help and you want to schedule an appointment with us here at Rising Health in Knoxville, we can do that too. You'll find the links to do that in our bio as well, or send us a DM. We'll reply and we'll get you on the schedule. Remember, the nervous system and the immune system are meant to heal, are meant to recover and be in balance, not in this state of constant overreaction. So let's work together to help it do just that. Let's help bring your nervous system back into balance and to the other side of these daily challenges. That's all for this one. Thanks for watching and have a wonderful day.